Sorry for this. Are we ready? Okay, so I will tell you about AI, particularly trustworthy AI. I will tell you what it is. I'll give you a definition. I'll tell you how do we achieve that, and then I'll give you some example in the context of the exposing projects, including LongITools. So what is trustworthy AI? First, what is trustworthiness? So let me give you an example from a different field. So COVID-19, if you remember the vaccine a few years ago, within a few months, millions of people went and got vaccinated. So obviously they trusted the vaccine because we have experience in making vaccines, in validating them. So more or less we trust them. But still, even though it's something we know how to make, some people didn't trust them, like this guy. I don't know if you can recognize him. Okay. Yes, Djokovic. He was deported from Australia because he didn't want to get vaccinated, and he was competing for the record of wins in Grand Slams, and but he didn't care. He was like, I don't trust this vaccine. So his biggest rival won that tournament. It was a disaster for him. But just to illustrate that this happens in a field where we have experience. So imagine in AI where we don't have still a lot of experience. Let me give you an example from AI. So this came in 2020 and it was everywhere in the news. It was done by Google Help. So these are big players. And they showed an AI tool that could detect tumors that experienced radiologists, were 6 in this study, could not detect. This is amazing. This is a Ferrari type of AI, right? Another question is, would you trust this? Would you use it? You or somebody or your loved one? Well, you'd be surprised it was heavily criticized, and it ended up being a Twingo, not really a Ferrari. So it was called useless, for example, because if you read the paper, there are not a lot of details. So because it's a private company, they said, we've developed this AI tool, and you had sort of to believe what they were saying. So that's not great. And another problem that you can see in the paper is that in some cases where the tumors were clear, all the radiologists could see them, the AI tool was making a mistake. So that's terrible. So it's not robust. So that's another characteristic of trustworthy AI. Trustworthy AI tools have to be robust. And then they tested it in the UK, in the US, that's quite good, but not in other places. So it works in some Anglo-Saxon countries, and that's it. So it's not really universal. So we want something that would be useful for everyone. Now, let me tell you about another characteristic of trustworthy AI, which is the fairness, which you've heard about for sure, which is the idea that AI tools should treat all subgroups equally. So in this example, which is about respiratory disease from chest X-ray, they use these big databases from the US that everybody's using to do AI. And then they found out that actually, if you just build a baseline AI model, it discriminates against female, young, and Hispanic patients. That's not good. Another thing is explainability, because perhaps you heard about it, but some clinicians in particular are saying we're not going to use AI if you don't give us an explanation on how the AI model got a decision. And this is an open question. There's a lot of research on it, but some papers every now and then show that the existing AI, explainable AI techniques don't work very well. They give explanations that don't make sense clinically. This is a problem, an issue called trustability. Some data scientists think this is the biggest problem of AI, is the fact that data changes over time. You could have an AI tool today that is accurate, robust, fair, amazing, a Ferrari, but then in 1 year, it becomes a Twingo. Why? Because the data changes a little bit over time. And even the disease changes. This is even more amazing. So you had COVID-19 and you had different waves, different variants, and the disease changed a little bit and the phenotypes changed. And now the AI models are sensitive to those changes. So what it says, this principle is that you need to check that your AI tool continues to work over time. And finally, this is clinicians in particular say that you can have a fantastic AI tool, you give it to clinicians and they don't like it. They can't use it in their daily practice. It's not usable really. The usability is another characteristic of trustworthy AI. So these are the characteristics that I presented. If you put them in the right order, you get this very nice acronym, I think. And yeah, so you could argue, well, we've heard of other characteristics of trustworthy AI and they're not here. But we've shown in the paper that they are, you can relate them to these 6 core principles. So for example, accountability is related to trustability, because for an AI tool to be accountable, you need to track the tool over time to know where errors were made and so on. And safety is directly related to robustness. So these are just examples. Also to say that some people call trustworthy AI ethical AI, because really these principles, they are related to ethical principles and also fundamental rights. So fairness is a right to non-discrimination and robustness is right to safety, for example. So sometimes you hear about ethical AI. Some people also call it a responsible AI, but it's more or less the same thing. In EU grant, in the template, they talk about AI that are technically and socially robust. That's the terminology there, but it's more or less the same. Huh? Okay, so now how do we achieve it? Because you can have nice principles, but that's not enough. Some people, when they write grants, they say, we will check that our AI tool comply with ethical values, but they don't say how they do it. And the how is important. And to do this, we build on what was done in the past in other areas. So Sylvain presented the fair data principles, and we said we'll do the same. The way they did it is they selected some principles, and for each principle, they had a number of best practices. So for example, the metadata should be assigned a globally unique and persistent identifier, and so on. And each of these have then examples. If you go on the website, they have examples on how you should do it. So we did something exactly the same. So the way you do it, okay, we talked for 3 years, a lot of people, first in Europe, and then we invite a lot of people from all continents. There was some disagreements, we iterated, some left the consortium, they disagreed, etc. And eventually we got something, I think, that works more or less, that we will have to update. But the way it works is the same. We take a principle, for example, fairness, and then we subdivide it in a number of best practices, and each is subdivided in a number of actions. And we put also examples on how to do that in the paper. So, and in the temporal directions, this is how the best practices are organized across the design, development, evaluation, and deployment stage. I'll give you some examples. So before, the way we did AI is typically you had an idea, and then you looked for data somewhere, developed the models, and then you estimated the accuracy. And more recently, people started looking at generalizability. They did external testing and sometimes fairness. And what we propose is to do it differently. The first step to do is to engage stakeholders, and I'll give you some examples. This is really important for trustworthy and ethical AI, otherwise it's not going to work. And then these stakeholders will help us understand and co-design the AI tool. We need to understand the end user requirements, the contexts, the ethical risks, and so on, the sources of errors, so we can anticipate on how to build the AI tool. Instead of building an AI tool and check whether it's trustworthy, we do the opposite. We come up with the requirements, we design a tool and mitigation measures, and then we select the right data, representative, not the data that is available, but the data that is right for that problem. We implement mitigation measures, AI methods. This is probably the most developed part. And then we evaluate all these dimensions. We don't only evaluate accuracy and robustness, but also fairness, explainability, and so on. Reporting everything that's important, including the limitation. If there are limitations, it's fine, but we need to report them. And we need to monitor the AI tool post-deployment, as I explained before. So let me give you an example. So in the paper, we explain how to do stakeholder engagement. You can use interviews, co-creation meetings, focus groups, surveys, and so on. So this is an example from a project funded by the European Commission called AI for Heart Failure. So we met at the European Society of Cardiology. We invited clinicians, but also patients and ethicists and other stakeholders to tell us how we should best design this tool. And we also meet online, so we don't have to meet always in person. I learned this tool from LongITools, actually, thanks to you guys. You can do surveys and get all sorts of information and so on. And why is it useful to do this? So for example, here's an example where talking to patients was key. We talked to cardiologists and they told us this is what we should predict with this AI. We predict the risk of myocardial infarction or the risk of mortality. And it makes sense because if they know somebody has a higher risk of mortality, they can change the treatment. They can do something about it. But when we talked to the patients, they didn't like it at all. They wanted something different. They said, can I know what is the risk of me being tired? Because perhaps then I will adhere better to a treatment A or B. So suddenly talking to patients is very, very important. Another example. So we wanted to know what are the sources of biases. And in this project, we have a team, we have an institution from Peru and another one from Tanzania. But still we said, well, we know the sources of bias in heart failure. Cardiologists told us it will be sex, age, perhaps ethnicity, socioeconomic status, and particularly ethnicity. And we were excited about Peru because it's a very multi-ethnic country. Like you cannot imagine, these are 4 past presidents of Peru from all ethnicities. Incidentally, they all went to jail later on. Question? Sure. Surprised when we spoke to these guys, they were not really excited about ethnicity. We were disappointed. They said, but we have something that is a problem in Peru. I don't know if a source of bias, like a big one. I don't know if you can imagine what it is. I don't know if you have ever been to Peru. Yes, altitude. Whoever said altitude. Have you been to Peru? Well, this is the altitude in Peru. It's crazy. There are people who live at 5,000, a lot of 3,000, and so on. And apparently their hearts are different. Even the definition of heart failure is different. Can you imagine? So, of course, that's a source of bias. But if we hadn't had that stakeholder engagement, we would have never known this. We would have built a tool. We would have evaluated for sex and age. But really, that tool would have been very biased. Another example why stakeholder engagement is important. This is an AI tool in Kenya to help midwives do obstetric ultrasound screening because they don't have obstetricians there in those villages. So we said we'll add AI to it and perhaps we can help them. And then we said, okay, let's talk to the stakeholder, in particular to patients. So we had these meetings. And we were kind of worried because they were not really interested in this tool. So you have to understand these are communities that have their own cultural beliefs, religious beliefs, and so they were saying, well, this thing will hurt my baby, etc. They were not really excited about it. Okay, so we have a social scientist who went back to talk to them, and they asked him a question: what can we do? What would we do so this AI tool, you would trust it? And they told us, well, if my priest told me to use it, I will use it. Something very simple. We said, okay, we need to talk to the priest then. So we went to talk to the priest. So the priest said, okay, this is interesting. We believe in technology. We are modern, no problem. But can you tell me a little bit more about the tool? And we said, well, we'll do something that we do in Europe, which is a typical obstetric ultrasound screening. Look at the viability, number of fetuses, sex, and so on. And they said, great. But there's one thing I would like to remove from this tool, otherwise we will not support it, which is sex. Because there's something called selective abortion. We said, okay, we remove it. So that's why it's important to co-design the tool with all these communities, because then they tell you how to do it properly. Otherwise, you make a mistake, you build a tool, you think it's great, you send it and nobody's using it. All right, and then you move to the development of the tool. You need to acquire the right data now. Now you know what is the right data. You know that you need altitude. And you know where you're going to be using this tool. Is it, for example, a private or a public institution? And now you have the right data. And then there are many AI techniques to solve problems that you may have. So, for example, if you have a problem that the data is diverse across institution, there's something called domain adaptation that you can use. And we've showed that using domain adaptation, you reduce the errors to almost a bare minimum. There are other ways to fix problems of fairness. So in this project, so this is a European project on cancer, breast cancer, we realized that we have a big problem of bias with respect to high density breasts. So that's 5% of the population. So it's really small. Most women have low density breasts. And the AI tools were not working for this population. So they would be excluded or discriminated against. So the way we fixed it, so there are solutions. The way we fixed it is to generate fake images with high density breasts. So we take low density breasts and transform them using generative AI, which is something like ChatGPT, and we generate more data of the minority groups. Okay, and now we need to evaluate. So we need to evaluate in different settings. So in this project, we evaluated in high-income countries, including Sweden, in emerging European countries, in Croatia and Poland, and then outside Europe, in Argentina, Turkey, and Egypt. For evaluation for robustness, for example, in the project on AI for heart failure, we were told at the design phase that ECGs vary and sometimes the electrodes move or there is motion of the patient, and that causes noise. So we need to check that the AI tool is robust to those variations. And again, because we did the job properly of talking to the stakeholders, they told us about this problem well ahead of time and we could plan. For usability, it's simple. Instead of just saying it works, give it to end users, for example, clinicians, in this case, radiologists, oncologists, and other type of end users, and ask them to test it, and then they will tell you whether they like it or not. And if it's something they don't like, then you can iterate and update your AI tool. You need to report the results of your validation. You need to monitor the tool over time. There are different ways of doing it. There's something called quality control to check the quality of your data, to make sure that low quality data sets are identified before the AI decision, so to remove potential errors and problems. The other ways we did it, we build tools to check the uncertainty over time and so on. Okay, so this is how to do it. And now, what about Trustworthy AI in relation to the exposome? So to tell you about that, I will use these two projects, LongITools, of course, mostly LongITools, but a little bit Stage as well, which is project that also exists thanks to Sylvain and has a part on exposome, but not only. And the diseases here, it's cardiovascular and metabolic, and here it's all diseases you can imagine. It's really multimorbidity. Bigger project. But we're trying to do something similar. Now, we have AI in both. So what's the difference? First of all, just to say that the LongITools was written in 2019 and staged in 2023. So back then, it was early days, kind of. So we didn't promise a lot on the AI. We didn't promise, what we promised is a Twingo. I hope nobody has a Twingo here. It's not that bad, no? But anyways, we did not promise a Ferrari. We promised a Twingo, and you can check it. All we promised was to build an AI model and look at the accuracy and perhaps where they generalize it. Nothing about fairness, nothing about explainability. I was very clever to do that.
It was robust.
And well, we'll get to that, whether it was robust. But that's what we promised, no? And I will make the argument that we delivered a bit more, a Volvo. I don't know if it's a good, but the problem in Stage is that we did promise a Ferrari. So let's see how it happens in a few years. But in Stage, we promised fairness, explainability, everything. So you can tell the other project officer to check that. Yes. But still, even though we didn't promise a lot, as time went, we said, well, let's try to do more. Let's try to do as much as we can in the context of Trustworthy AI. And I'll show you what we did and what we didn't do as well, and what we will try to do in Stage that we didn't do in LongITools. So first of all, just to remind you what we did in LongITools, we took all these input predictors, environmental factors, early life factors, lifestyle, social demographics, mental health, physical measures, and so on. And we built an AI model that predicts the risk of cardiometabolic disease. So this is how it works. In the app, it says that your level is low, for example, but really you have a score over time. And I really like this example that Maria gave me. And it can show that depending on physical activity and so on, the risk, of course, varies. And this is what we delivered. This is what we promised, and we delivered it. We published it. And we show that it's better than what exists before, which is the primary risk score, okay? And we would have been happy to stop here, but we did a bit more. So first, we did some stakeholder engagement. And probably there were more people than this, but this is the list of people that helped at the very beginning of the project, and I'm sure there have been more, representing all other work packages, and gave us some ideas about how we should build this AI tool and the app. We used it was online. I don't think we did much of stakeholder engagement in person. So, for example, what we did is we designed the interfaces, but also we selected which features to add to include in the AI model. Now, this is very important because if you include AI features that are not relevant in the real-world practice, for example, that would be problematic. Now, so we did some stakeholder engagement, and the question is whether this was enough according to the future AI guideline. And the answer is no, according to me, because, for example, we didn't talk to citizens. We did not. Okay, that's the way it was. We talked to them later, but at the evaluation phase. But that's, I would say, it's too late in a way. It's not really, let's say it's late. But really, you should do it at the design phase, according to the future AI. And that's what we did now in stage. So this is an example of stakeholder engagement that happened with patients in Oulu, Finland. So we prepared something in Barcelona. We sent it to somebody called Erika. Yeah, you know her.
Yeah.
She translated it to Finnish, and she spoke to these 5 women, and they said, we prefer this than this, for example, and so on. A lot of questions. So now we know what they prefer. That's great. So this is something we learned from LongITools, and we are applying in stage. What about fairness? Well, we tested some fairness. So we was not in the grant, but we said, let's do it. And we checked, and we found that the AI tools we built were fair with respect to sex, ethnicity, and age. That's great. So now the question is this enough according to the future AI guideline? And the answer, no, because the future AI guideline says you should not decide these factors. You should ask the stakeholders, the experts at the design phase, and they should tell you which factors are relevant, which could be the factors for bias. We did this in stage, and these are the factors that they told us, which we didn't even consider in LongITools. So, for example, sun exposure. So that's why it's good to have these discussions, no? And certainly socioeconomics. It didn't cross our mind in LongITools, that's not my team, to test bias with respect to socioeconomic status, but it's really important, in fact, when you think about it. So now we're doing it better in stage. What about universality? So what did we do? We used data from the UK Biobank, and we tested that if you build a tool from a number of cities in the UK and you test it in other cities, we found that it generalizes well. So our model is universal in the UK. That's good news. But unfortunately, as Nusa showed this morning, we struggled when we went outside the UK. And for reason I'm not going to, it improves a little bit if you refine the model, but not sufficiently, in my opinion. So we partly built a universal model within a single country, but not within Europe. And hopefully in stage, we can improve that as well. Traceability. So here we tested tools across time intervals, and we found that they break down somewhere in 2013. And what we found is that there were some variables that were changing over time. So education was staying in. So I guess what happened in the UK Biobank at the beginning, they recruited a lot of educated people. Perhaps the volunteers were mostly educated. And over time, with promotion, etc., people that had no education started to join the UK Biobank, and that changed a little bit the distributions in the UK Biobank, and that affected the AI tool over time. That's really important. That's why it's important to check your AI tool over time. Usability, Maria's team did something really cool. They took the app with the AI tool and tested it in 3 places in Italy with 15 people. And they got a really high score of acceptance. They translated something called the system usability scale to Italian. And the question here as well is this enough? There's a lot to be said about this. For example, when it was only 15 people, so perhaps we need more. Or you could say it was only in Italy. I noticed that somebody didn't like it very much. No, they have 30 score over 100. So why is it? And it would be good to study all this. But of course, that's perhaps something to do in the future to iterate and try to improve the tool. And instead, that's what we're doing. So these are other questions that were asked to the citizens so they could choose different options on how the AI tool would be developed. For robustness in LongITools, we estimated whether the tool were robust when certain variables had a certain level of uncertainty. Okay, that's okay. But what we didn't do, for example, is to check whether the tool is robust if you change the devices. We didn't do it. Perhaps in the future we could do it because this happened. People have different devices. And finally, explainability, we did a relatively good job, I would say. This is from the paper. We provide explanations on how these AI decisions were made. Okay, conclusion. So in LongITools, we addressed some of this partially, I would say. Some we did a very good job, some need to improve a bit, but we've learned a lot from the experience, and certainly in new project like Stage, but others, we'd like to do this in a more systematic manner. But the message of the Future AI Guideline is that stakeholders are really important. It has to be human-centered. It's holistic. You cannot choose, you cannot say, well, this I'm not interested in traceability, or you have to have everything, otherwise people will not trust the AI tools. It's really holistic and so on. Okay. We have a website. We organize events every now and then on Trustworthy AI. You can sign up here. And that's it, really. This is a photo. I just wanted to put it here. I liked it. I saw it this morning in one of the deliverables, and I liked it. Also because some left, actually, the project, but really they played an important role. Valentina. Marina couldn't make it from my team, but she's amazing. And just wanted to say that. She's now in Stage and doing an amazing job. And yeah, thank you everybody who helped, because it's really, really multidisciplinary. That's also the message of Future AI. Data scientists, they're not very good at developing AI tools in reality. We're not very good because we are so focused on the methods, but it's important to have this discussion and this dialogue to build tools that are trustworthy and ethical. So this result came from different European grants. So big thanks to the European Commission for funding all this, really, because that's where it comes from. And yeah, thank you, LongITools. Thank you.